Well, good afternoon, everybody, and welcome back once again to the United Regional Chamber's weekly update. We try to bring you on some interesting guests and some services and programs from around the area. And one of the things that we've talked about a little bit is our aging population. A lot of our parents are getting older, and there's different options out there for them, especially if you are a working couple and you are responsible for taking care of your senior parents. So today we're going to introduce you to Miss Sydney Marchand. She is from Joyful Living Adult Day Health Center here in Attleboro. Miss Sydney, welcome.
Thank you for having me.
Well, you're kind of new in town. The center's been around for just about a year, but it's time for more people to understand what the differences are between a center like yours and the senior centers and nursing homes. So I figured we'd get into a little bit of that today. So first off, tell us, what's the difference between an adult daycare center and a senior center?
Really is that the senior center, these folks are very independent. They come and go as they please. They don't have to come every day. Maybe you see them once a month. But really, the adult day center is for folks who need assistance with some aspect of their daily living, right? So maybe they need reminders for medications. Maybe they need assistance getting up and down out of their chair, or they have diabetes and they need insulin, some sort of a medical need. And that's what we provide here at the Adult Day Center. We have a full-time RN on staff Monday through Friday, 8 a.m. to 4 p.m., which is our hours. So you get that hands-on care when you're at the center, as opposed to the senior center where you're kind of doing your own thing throughout the day, right? You're there for an extracurricular or whatever they're having. Here we tailor the care to each person. So maybe somebody does need some medication during the day, and maybe somebody else who's here doesn't need medication, but they need some other medical attention. So that's really the main difference, is the medical model, as opposed to just the social model of a senior center. It's a little extra.
Okay, and we're all concerned about our aging parents, and tell us, what's a day like there at the center? What's it look like?
So we provide transportation to Attleboro and the surrounding towns, and it depends. Some people use our transportation service, and then some people have family members that provide that transportation every day for them. So you might get picked up at your home in the morning. You're here by 9 a.m. Once everyone is here at the center, we provide a healthy, nutritious breakfast for everybody. We sit, we chat, we have coffee, breakfast together, light conversation, and then we usually start the day off with some sort of an exercise program, whether it be a walk or a seated exercise. And then from there, we do various activities. Every day is a little different. We might do indoor bowling. We might have outside entertainment that comes in and plays music. Or we may go to Capron Park Zoo, which we've done, or go out for ice cream. We provide lunch as well. And then at the end of the day, either the family member comes to pick the participant up, or we bring them back home. So it's a very structured day to keep our loved ones moving and going, keep them healthy, keep them interacted with one another. That's one of the most important pieces too, as well, about the Adult Day Center versus the Senior Center. They're kind of on a regimen every day, which really helps them to know what to expect every day when they come into the center.
Okay, and is your services provided through health insurance, or how does one pay for an adult day health program?
Sure. So a lot of insurances do cover the adult day program, and it depends on what you have. So a lot of the insurances that we're contracted with are part of the SCOs, or senior care options. So that could be United Health, Tufts, Fallon, Mass Health, any of those. And then it depends on what that insurance is, if you have your main insurance and then a subpart to that, it may cover 1 to 5 days. It may cover 2 days. And then depending on what the participant or the family member needs, if you want to pay privately for an extra day, maybe your insurance only covers 3 and you'd like to go 4 or 5, you have that option as well. So what's really great for a lot of folks is that most insurances do cover this program, which really helps those who, have maybe thought about assisted living or, but they're not sure that they have the funds because it's expensive. This is another option for them that really cuts the costs and puts people's mind at ease about their family member during the day. So insurance does cover this program.
All right. Well, why should somebody consider going to an adult day health center over a nursing home or an assisted living or the full-time home care?
Right.
Um,
Right. So full-time home care is great and maybe adult day isn't for everyone. But there is a cost to all of these things. So I come from a background in assisted living, and I do know that it is costly. There's a fee to move in, then there's your monthly rent, and then there's care on top of that. And we all know as we age, we will probably need more than what we, started off with when we moved into a facility like those. So for folks who don't have the funds, or maybe they're just not ready, they're nervous to take that step. The family members are nervous to take that step to an assisted living or some other institution for their family member. This is a really great starting point because it kind of simulates what those other facilities do in programs, right? You have your activity director, and they have a schedule throughout the day as well at those assisted livings and other facilities. So this is a good stepping stone if you're headed in that direction. But also, even if you're not headed in that direction and you're being cared for by your wife, your sister, your children as an older adult, this is a great way to give respite to those family members. Or maybe those family members are working. You can bring your family member here and they can participate in programs and meet other people and be safe and healthy and have everything that they need. And then they can go home at the end of the day. So it gives you that space to not be caregiver 24/7, because that's hard for a lot of family members, right? You want to be the wife, but you're also the caregiver, and you want to be the daughter, but you're also the caregiver. So it's really beneficial, not just for the participant, but for the family members themselves.
yes. Now, do you work with folks that maybe have some dementia or is having some mental issues?
Yes. So some of our participants or people that have come into the center and have toured our center do have some form of Alzheimer's or dementia, or even just regular aging memory loss. We do accept participants with dementia or Alzheimer's. It depends. And there is a process that we go through to make sure that if this person is joining the program, that they are safe here and that we are able to care for them. So that is something that, yes, we do work with folks with dementia and Alzheimer's.
All right. So share with us what is the process of getting one of our loved ones into an adult day program?
So you can contact myself, or we have a fantastic program director here. Her name is Maria Gateman, and she's really in charge of the day-to-day here at the center throughout the week. So you would come in, you'd chat with myself and her. We would get to know the family and the participants' needs. You would take a tour of the community, ask questions. And then if you wanted to move forward, there's some paperwork that you would fill out. Whether that be a form to send to your PCP to get permission to have your medical record so that we can properly care for you when you're in the program, things like that. And then you would do an assessment with our director of nursing. So she'd sit down with you and she'd ask you a series of questions, kind of like being at the doctor's office, to make sure that we have all the proper information that we need in regards to you and your health when you're here at the center throughout the day. After that, we send a lot of our information to an intake coordinator who works with the insurance company and you and your family to go through that process and make sure that you're qualified. Sometimes the insurance company will come out and do their own assessment of you as well. And then after that, it's kind of smooth sailing. Once we have all the paperwork that we need, once the assessment has been done, we've established whether you're going to have transportation, whether your family's going to come and bring you to the center, then you can officially start the program. It's a little bit of a process, but it's good that it's a process because we want to diligently make sure that we have everything that we need so that you're safe and your family members know when they drop you off to the center, you're going to have a good time and you're going to be healthy, and you're going to be well taken care of while you're here.
Well, folks, if you haven't had the opportunity to stop by and visit, it's a brand new, beautiful facility right there on 67 Mechanic Street, inside the Sterling Lofts. As you face the building, you go into the driveway to the left, and down there we had a great ribbon cutting here not that long ago, and we helped them open up their center. And coming up, we're going to have one of our Alive After Fives there to introduce some of our businesses to the Adult Day Center as well. And Sydney's putting on a luau theme, so we ought to have a little bit of fun. So, Sydney, any last comments before we go?
If you are still confused or you have questions, you're not really sure if this is the right fit for you, call and ask, or I'll meet with you here at the center. I'll meet with you for coffee. It can be intimidating. You don't walk in and you don't have to become a participant. If it's not the right fit, it's not the right fit, and that's okay. So please don't be afraid to ask questions or call Maria at the center and ask her any questions. Email me. I'm happy to sit and chat with anyone and clear anything up and help family members figure out if this is the right fit for them.
Awesome. Well, Sydney Marchand, thank you very much for joining us on today's show. Folks, hopefully you've picked up a little bit of information, and don't hesitate to reach out to Sydney and her team over there. They'll be glad to answer any questions that you have. Big thanks also to James Friedman and his team over there at AACS for putting up with me every week. And we appreciate all that you guys do. Sydney, thanks. We'll see you out at one of our next events, probably next week, at our cornhole event.
Yes, I'm looking forward to that.
All right. Folks, again, thanks for joining us. And everybody, please stay safe.